This talk focuses on young onset dementia and in particular on what we've found out about what positively experienced services do that enables them to meet the needs of people living with young onset dementia. Given that most people with young onset dementia currently receive poor services, we're keen for lessons learned to be taken forward into practice. I'm Jan Oyebode from University of Bradford, and I'm presenting on behalf of myself and my colleague Vasileios Stamou. So we have twin aims for this presentation. We'd like to present and bring alive the qualitative thematic analysis of over 800 examples of positive service support given to us by respondents to the Angela Project survey, integrated with data from in-depth interviews with 24 people directly affected by young onset dementia. But we'd also like to provoke you to consider how this knowledge could be brought into practice to improve services. You'll have seen a note about the Angela Project's funding and leadership on the previous slide. This was the largest study to date in the UK on care for people with young onset dementia. We gained a big data set on issues around diagnosis and post-diagnostic support, which has led to 9 outputs to date, with others to come. We're hoping to follow on with some further implementation studies, depending on funding. Today we'll present findings that aren't yet published but are under review. However, first we'll put this in the context of current care for people living with young onset dementia. Those with young onset dementia are a minority of people with dementia, but nonetheless there are estimated to be about 35,000 people in the UK living with young onset dementia. Diagnoses of young onset dementia are much more varied, and so they affect cognition in a great variety of ways, meaning that although some contend with the memory deficits typical of Alzheimer's disease, others experience language, visual or behavioural problems as their primary difficulties. Because those are affected are at what's usually a very busy, productive time of life that carries lots of responsibilities, it has a very different impact to be diagnosed with dementia at a younger age. As it's so associated with old age, it's unexpected, so has a major disruptive effect on sense of self. It disrupts relationships and support that may be being given to ageing parents or young people or children. And it causes people to have to retire prematurely from work, losing income, with financial consequences at a time of considerable outgoings, and also impacting on future pensions. The dementia's impact on cognitive, social and physical skills may not only mean the loss of employment, but also that the person's unable to continue to pursue their usual hobbies. Overall, young onset dementia has very dramatic, far-reaching consequences. People with young onset dementia don't have a clear pathway to diagnosis or post-diagnostic support. A GP may initially suspect a brain tumour and refer to the neurology department, or suspect a mental health issue and refer to adult psychiatry. If they do suspect young onset dementia, they may refer to a memory clinic, but this is likely to be an all-age service without in-depth experience of young onset dementia. Our survey showed that only 20% of people with young onset dementia received their diagnosis in a specialist young onset service. These different pathways give rise to disparate experiences, and often people with young onset dementia are met with lack of understanding by primary and secondary healthcare professionals, as well as in social care, precisely because the condition's relatively rare and they don't fit the stereotypical picture associated with dementia. Once people have gained a diagnosis, some are discharged with no support, and if they're offered a service, it's commonly set up for people in their later life and not appropriate for those in middle age. The bulk of care falls on families, commonly a partner or spouse, and you can see here the care costs associated. These are calculated using an hourly salary typical for a care assistant and you can see that families are putting in the equivalent of many thousands worth of care. So in summary, there's no clear care pathway and is frequently no age-appropriate or diagnosis-appropriate post-diagnostic service. Against this backdrop, we ran the post-diagnostic workstream of the Angela project. You can see the main constituents on this slide. And today we're focusing on a subset of the qualitative findings from the survey and interviews. Time precludes a detailed description of methods, but in brief, we asked for free text responses in our survey about positive experiences of service support. We conducted inductive thematic analysis to look at dimensions of what was provided, how it was provided to make it positive, and why it was viewed as positive. This led to a thematic template which was used as the basis for analysis of follow-up interviews that explored the same issues in greater depth. And in this talk, we're focusing on what and why. Our sample in the survey consisted of a mix of people with young onset dementia and their primary supporters. The people with young onset dementia had an average age in their late 50s, and we had a good mix of diagnoses. The sample included a number who live alone and people who still worked. We had some variation in ethnicity, but would have liked more, and we had some people who lived in residential care, but again, not many. The follow-up sample were purposively selected on the basis of their survey responses. And again, we had a reasonable degree of diversity, including following up with people from minority ethnic groups and those who had rarer diagnoses. Our analysis resulted in 8 themes about why services were perceived as positive and 8 themes about what services provided for it to be a positive experience. We grouped these into 3 superordinate themes that you can see on the slide here: to be myself, to have autonomy, and to feel togetherness. And underneath the superordinate theme headings, we've clustered the why themes. People's ability to retain their sense of identity and be themselves was enabled when services addressed physical health issues, mental health issues, and gave opportunities for meaningful occupation. And you can see here a quotation from a man living with young onset dementia, for whom creative writing had been at the centre of his life, and you can see how much he appreciated it when a charity gave him the opportunity to continue to pursue that interest. And he says, "The charity offered their premises for me to deliver a creative writing workshop. That's been good because sometimes you need to be validated, or your aspirations need to be validated as more than just a little whim or excitement." His first sentence shows how this strengthened his sense of identity. He says, "I'm still full of the person who I used to be, who I am. I'm still full of the youngness, full of energy and enthusiasm." Services promoted autonomy by giving young onset specific information or advice that empowered people with knowledge, by giving them access to age appropriate services, by giving support when needed with activities of daily living, and by giving them a voice so they gained control. And in this first example, we see how someone emphasises the importance of age-appropriate services. When you find people who are willing to talk to you on your level, appropriate to your needs, rather than just try to apply your needs to fit old people's services. And in this second quote, we see the example of someone who was in his 40s when he got a diagnosis, and we see that he was able to continue to pursue his passion for woodwork with support from someone who could make sure he didn't injure himself with his woodworking tools. And he says, "I have a buddy who helps me decide the things we can do. It's just like having a more able version of myself." Togetherness was promoted both in terms of helping people to continue relationships with their family and important others, and a contribution to society. So in this top quote, we see how someone benefited from specialist sessions of speech and language therapy, a specialism that's not very common in old age dementia services, but can be very important for people living with the language variants of dementia that are more common at younger ages. And you can see how it not only helped with communication, but it helped with relationships too, by addressing the needs of the couple together. In this bottom quotation, we see the benefit gained when services are provided for the wider family, in this case taking into account the needs of two daughters aged only 5 and 11 when the man in the family was diagnosed. Many late onset services won't be used to dealing with children and young people, so again a specialist skill is needed within services. And in this final example, we see how a service that offered someone the opportunity to take part in a gardening group helped them to feel they were still contributing and were useful. He talks about how I'm happy, and if it makes a difference to others, it makes me feel happy as well. There's nothing worse than the feeling of not being of any use. So, our findings imply that positively experienced services minimise the disruption of young onset dementia by enabling people to retain or regain their sense of self and self-esteem, by enhancing their sense of agency and control, and by helping them to sustain connections through meaningful relationships with family and those close to them, and with society in general. The high-level themes may appear very generic, but I hope that we've shown through the examples that the specific context of young onset dementia demands specific services that are age appropriate and diagnosis appropriate. If you work with people with young onset dementia, this talk probably hasn't told you anything very surprising. However, its value lies in our systematic gathering of a large data set from the first-hand experiences of people living with young onset dementia and family members, and our rigorous analysis, and we hope this can be used as evidence ammunition to argue for service improvements, not least given that 80% of people with young onset dementia don't have access to specialist services. So we've already started working with Young Dementia Network to produce resources for professionals and planners that they can use to improve young onset dementia services. Moving forward, we need to implement evidence-based changes in services, and there are so many things that can be done. For example, assessment of need for care plans could be based around our 8 why themes, establishing which are pertinent for particular individuals. Services could do more to implement family or couple-oriented approaches as opposed to individual support. And they could do more to provide age-appropriate activities and engagement opportunities in line with the personalisation agenda. There are what could already be described as beacon services that do these sorts of things, and which are appreciated a great deal by those living with young onset who receive them. So, for example, Jackie Hussey has described the Berkshire Young Dementia Services in a recent article in the Journal of Dementia Care. We also need to draw attention to the area of young onset by including young onset specific guidance in standards and guidelines. So, for example, there are now a small number of young onset related standards in the MSNAP, the Memory Services National Accreditation Programme, criteria. So our challenge to you, if you're listening and you're a commissioner or provider, would be what sort of young onset pathway do you have locally, and what age appropriate services or pathways could be followed that promote people's sense of identity, autonomy and togetherness to help them live well with young onset dementia and to prevent crises which take them into I mentioned the Young Dementia Network. If you don't know about it, details are here, and on the website you can find links to all our papers, but also a whole host of other useful resources and information. Thank you very much for listening. If you have any questions or comments, we'd be pleased to hear from you.